Hey guys, welcome back for another episode of the AltMed podcast. It's, as always, Mitch Kurtz, my co-host in the seat next to me, virtually, of course. And we have two wonderful guests today joining us from different parts of the world. We have over in Perth from Health House International, Paul Maverick. I don't know. We'll go with Mavor. And we'll get to why we say that in a little bit. And over in Barcelona, I hope I've got that right, we have David Attwood from Canpharma in Europe. Welcome, Paul and David.
Hey, everyone.
So you
start with a bang.
Yeah, as we always do. We might start with you, Paul. You were, at least, from my research and involvement in the medicinal cannabis space, definitely one of the first companies that I saw, if not the first, in Health House International. Perhaps if you can tell us a little bit about your background and about Health House and how it came to be the maverick in the space.
Sure. Yeah. Well, we were definitely the first to import cannabis into Australia under this new legal system, and I fell upon it quite by accident because I stumbled across medicinal cannabis early in the piece, and I thought this is going to be absolutely massive, but not for 10 or 15 years. And then lo and behold, several months later, the laws changed thanks to others, and it went straight through Parliament, and I found myself in the thick of it. And there was a real opportunity to get products to Australian patients, and I had made a lot of contacts overseas, attending conferences and travelling to other jurisdictions and looking at grow rooms and meeting scientists, and had access to some world-class product from Canada, from one of the companies over there, Prairie Plant Systems, who they produced one of the first oils for the Canadian market. And we imported that into Australia, and it came flying through. It took a little bit of time to set up because one of the first international exports from Canada was actually one of the first globally in this new wave of cannabis. And the health minister at the time, Greg Hunt, was literally on the phone to me, pestering me, Paul, how quickly can you import this cannabis to help patients? And at the time, we went and picked up the order. Only a small shipment, and I shook all the customs guys' hands, and they said, look, normally we're trying to catch guys like you trying to bring cannabis into the country, but it was a bit of a laugh, and I took a selfie and sent it to the health minister.
The sneaky pharmacists.
With the logo, the eagle has landed, which he's used since when a pallet load of COVID injections landed into Australia. But
did he... Did he request that you come and visit him and show him the products and, maybe do a bit of a sample exercise at Parliament House, or how did that all go down?
No, he didn't. I pretty much texted him, and I never met him in person. And I've since met him because he's very supportive of research. I've introduced a few researchers to him, and he's very supportive of that space, which is good because I think Australia's really leading the way in a lot of areas because we've got access to GMP product, and there's this big appetite for not only the regulator but some of the politicians, as well as funding for some really great research projects, which is a whole another webinar topic.
Well, I've just got a query on timing, because I know that a lot of people in Australia who have sort of supported the space even before legalization of medicinal cannabis. I think, we've spoken previously. So this was around about 2017 that you got that first import in.
Yep.
And my recollection is that the different states and territories around Australia, it was a bit like a domino effect, watching them all enact legislation to make it available. Which, I'm just curious, which part of Australia did that very first import go to?
Well, the first shipment actually went to Queensland. There was a palliative care doctor over there who I'm still in touch with. And at the time, some of the various state health departments, had no idea what cannabis was. And in the case of most of them, they classed it at a very, very high level. And in West Australia, they've introduced some regulations around based on dexamphetamine, which at the time there was thousands of prescriptions for. And they wanted to decrease the number because a lot of it was being diverted. And I'm proud to say I've not seen one instance of cannabis being diverted to the wrong people. Patients are getting it like any medicine. There is a potential, but they put some very strict guidelines on it. Since they made it specialist prescribing only, and it was about a 2-month process for patient access. In the case of palliative care patients, they want access straight away because they're in a lot of pain, and this may benefit. So some of the early patients, they did it tough, and I'm ashamed to say it didn't get to them. But some of the regulators have since learned the sky hasn't fallen in, and this can really help the right patients for certain medical conditions. And it's gotten a whole lot better. In most cases, it's gone from specialist only to GP prescribing, and there's pretty much a 24-hour turnaround. And the fastest we've heard of is a 3-minute approval from one application.
Wow.
Those barriers are in place now, but I think moving forward, it's going to get even better and even easier for patients. We're seeing a world of changes, and I'm sure you guys have seen in your time in the industry as well.
Absolutely. And it might be worth at this point also getting a little background on David and how he got into the Canpharma and cannabis space in general over in Spain.
Well, thanks guys. And I mean, I guess as everyone's already picked up from my accent, I'm not Spanish. I am based in Barcelona. I came here nearly 20 years ago to study an MBA, and ended up staying. I mean, going way back prior to the MBA, I qualified as a chartered accountant with PwC. But after the MBA, I've done a number of regulated industries. I worked first in renewable energy, and then vaping. And I say regulated industries, but they're disruptive sectors in regulated industries. So innovation. I was looking around for something new, and looked at cannabis, dug into it, thought this is not going away. This is a plant, a medicine that is going to has been hidden away from patients for a long time, and the evidence will build and this will happen. So I stepped across to a company called Prohibition Partners, which is a sort of a leader in insights within the market. And I set up their consulting team there. And then having told a lot of my clients that the only market of scale in Europe is Germany, and the place to create value was in distribution, finding a route to patient, I was lucky enough to meet the German founders of Canpharma, 2 of whom live in Barcelona as well. And so I started talking to them, and I moved across to them at the beginning of last year. And so I sit in Barcelona, but we also have operations here through Calapa Clinic, which is a medical cannabis consultancy, Europe's first medical cannabis consultancy that provides education to patients and healthcare professionals. Spain, medical cannabis is not yet legal, so we can't prescribe there, but we provide online services in 6 languages across Europe out of Barcelona. And on the Canpharma side, Canpharma is a distributor of medical cannabis, as I say, in Europe's only market of scale, which is still just starting. It's still nascent, but Germany has legalized medical cannabis 2017, and there is broad prescribing ability, but in any market requires doctor education and patient education, and that's what Canpharma is all about. Not only distribution, but adopting a holistic approach to the patient. So as I say, I stepped across at the beginning of 2020, and the reason I'm here today is that we've entered into an agreement where Health House will buy us, and we'll be part of the bigger group, which is something we're all really looking forward to, and leveraging experience off the group, which is Paul's built up down there in Australia.
Yeah, fantastic. Were you going to say something, Andrew? Because I think this is a very interesting area. I know it's a bit of an interest area for you, the export market, and it gets raised a bit in Australia, this kind of import versus export scenario. And did you want to ask a question on that?
You're on mute.
Oh,
you're on mute.
Sorry, I popped myself on mute. Perils of living opposite a fire station. I was going to ask just about, I mean, the timing's interesting. Germany and Australia both legalizing in 2017, but it's refreshing to hear that although we are a nascent market, that there are insights perhaps from our experience in Australia to be learned in other emerging markets. I'm just very interested in, I guess maybe both of you can speak to this idea of Australian LPs exporting to the world. Maybe first, Paul, if I can get your thoughts on what Health House's plans are or areas of interest, and then maybe David, if you can also chime in with any insights you have of the German market or any other European markets.
So Australia, actually, just a slight correction, Australia actually legalised in February 2016. We passed the law, and it wasn't until later on in 2016 where the law was enacted, but we had no products. But one thing the Australian government actually did well, they outlined a system for cultivation, manufacturing, and export licenses, as well as import licenses. And they set up a very robust system and some high standards. At one of the first conferences I went to, there was a girl there who worked for the TGA looking at how they test cannabis. And that's so important to have a standard. So when the regulators allowed companies to set up to manufacture, everything's made to a very high standard, which is important because it fits in very nicely to a pharmaceutical product. And a lot of other countries haven't done that. They've just rolled it out where you can make medical cannabis and there's no inherent standards. But it's actually really been a useful thing because a lot of cannabis from Australia that's been exported globally has fared very well in legal jurisdictions such as Germany and the UK, where it is highly sought after because it's of a very high standard, like a lot of agricultural products we actually export from here. So the future is quite bright in that respect. We've got some really good standards that the TGA monitor, and there's a big opportunity to export, and particularly the fact that we can get export permits to anywhere globally. There's no problems in dealing with the federal government in that respect. So that they've set up a really good system.
That's excellent to hear. And David, what can you tell us about this this German market that we're starting to see emerge? It seems very exciting. I've seen a number of companies. I think ANTG announced a big deal, export deal to Germany. What can you tell us about what's happening over there?
But yeah, Germany is an exciting market. As I said, it's been legal for a couple of years now, but it was almost legalized from the top down because the government under pressure legalized medical cannabis, but it was classified as a magistral formulation, which means that if you think back to the old movies where a pharmacist is grinding up product, that as a conceptual level is how it's done in Germany. So it restricts the form of products that can be prescribed to mainly sort of flower and oil. To date, it's been a flower market, but we believe that, and I believe before I joined Canpharma, that look, medical cannabis is not going to scale at any level until doctors can prescribe something that looks like a medicine. And dried flower has its place, definitely has its place within our portfolio and within the doctor's range of products can prescribe. But really, until patients as well can see something they feel comfortable with, then that's going to be extracts. Other form factors are trickier to get into the German system, but that's its uniqueness, and there's sort of a lot of innovation around what can be prescribed, and obviously the market will develop. And in that developing period, we're going to get a lot of insights about patients and real world data, analyzing how different indications, understand the regulators get educated. I mean, it's at a fascinating stage, the market. It's really building. End of last year, last quarter of last year, I think it was 3.5 tons of flower imported, and probably a similar amount from memory the quarter before. So we're seeing reimbursements from insurance companies tick up as well. So things are building, but more than anything, it's as I say again, it's a nascent stage. So it's a fascinating time as regulators, patients, doctors, and people like us all learn about and have to sort of weave their way through that early stages of market development. But the potential is huge. I mean, it's 80 million plus 85 million population of Germany. So of Europe, it's one of the biggest markets. It's the market that's being developed for the longest. So it's as I said, when I left Prohibition, I put my money where my mouth was and joined the distributor in Germany. So and I'm very pleased in retrospect I did.
That's great. Is it prescription only? And it's probably to throw you on the spot there. Do you know, like in terms of access, is it difficult over in Germany or?
It's difficult in the sense of any market that you've got to find doctors who are comfortable with prescribing, and so there is a really small percentage of doctors that actually have prescribed, or an even smaller one that are willing to prescribe. But that just shows the market potential through education. Once it's been prescribed, then it needs to be reimbursed, and there is unfortunately for patients, there is a significant part of the market where patients pay for their own prescription. But I think, I haven't seen the latest data, but it's around only two thirds of applications for reimbursement go through. So there is a mechanism there, and it will improve, but it's all to come. I think did I answer the question there?
Yeah, absolutely. Maybe. Oh, sorry, you go, Mitch.
I was just going to say, in terms of products, when you're saying, things that look pharmaceutical, that remind, a patient of walking into a pharmacy, as opposed to potentially something that maybe looks like you're walking into the herb section of your fruiterer. Are you talking about oils, capsules? What types of forms? For people I find that listen in are very interested in the types of products that are out there, and very curious to get your take on what might work in the German market. Is it topicals? Is it is it vape type products? And be very keen to learn a bit more about what that looks like in Europe.
So at the moment, it's just flour and extracts that's sort of taken under the orally. That's the real product mix. I think that's any significant scale in the German market. That's all there is. And I go back and say, look, flour has its place. I mean, for quick onset vape product, that's definitely has its place in the market. But for wider patient populations that may need pain, or I think around 70% of the German market prescriptions are for pain-related prescriptions, and obviously that's generally an older patient group who feel more comfortable putting something underneath their tongue than they would vaping or smoking. But it's across the board. So some of the other product formats that you mentioned, capsules, or maybe vape in the sense of electronic vaping, of that needs to find a way into the magistral system. So it's all about innovation and what can be done within that system. So yeah, we are looking at other form factors, but we're a little bit restrained by the regulatory system, which in all markets such as this will evolve as well. So I'm not saying in a couple of years' time you won't be able to have sublingual wafers or gel caps, but at the moment that's not possible.
And
it's actually
yeah. Oh, you go.
You go, Andrew.
I was going to say to Paul, I guess we're not as constrained by those parameters, and there's quite an array now of products available. Still not seeing topicals really. I know.
Yeah, I know, right? I've been spruiking topicals for the last 2 or 3 years.
Spruik away.
I'm going to use the word spruik a lot. But I've told there's a couple on their way, and it's not too long, because we've got cannabinoid receptors all over our skin. And I've heard anecdotal stories that they're of great benefit to patients, particularly in areas of pain and a few skin conditions. I'd like to see them for myself. It's a great area. But getting back to what you were talking about previously, I think oils are really popular in Australia now, but I think the future is in capsules, because there's a lot of complaints from people from the taste. People don't like leaving it under the tongue for 5 or so minutes till it dissolves, if they can just take a capsule. And particularly with some of the elderly patients, they have to navigate the adult-proof lid on the liquid. They can draw it up with measurement they can barely see on the syringe. Then they have to put it under their tongue, and it tastes awful, I'm told. Instead, they could just put a capsule in their mouth, and in some cases get better bioavailability. And a lot of elderly patients are on a lot of medication, up to 10 different types of tablets, sometimes multiple times a day. And a lot of medication they receive in these little blister packs or sachets, or they call them Webster packs, or dosette boxes, whereas it's a whole lot easier to put a cannabis-containing capsule in there, particularly if you're getting better bioavailability. It's good for patient compliance. There's a whole lot of pluses there, but we're not quite there yet. There's a couple of CBD capsules on the market. There's a bunch coming soon with containing THC. I think some of the new novel dosage forms are quite exciting that we're going to be seeing in the future.
That's excellent. I also think, even with the, maybe I'd like to think quite a few of our listeners, the small number that enjoy our podcast, they might be taking tincture products, and, when they dose, I'm still always saying to people that you're going to get a more precise and fixed dose from a capsule than, kind of going by the eye on a tincture bottle. But then of course the difficulty in dosing vaping and that sort of thing. So yeah, it's an interesting discussion. Are you actually, out of interest, vaping, is that something that you've dealt with much, Paul, here in Australia? Yeah.
I actually I didn't sell hardly any vape cannabis for a long time, but I think ANTG rewrote the record book because there's so much in demand in Germany that the Australian patients prescribers started to look at it as a treatment option. It really set the market ablaze here, literally. And, I think everything has its place, but certainly what we're seeing is not every patient wants to inhale something. It's probably not appropriate for the very elderly or for small children and people with low lung capacity. But certainly for breakthrough pain, it is a certainly treatment option in there that shouldn't be disregarded. But getting back to capsules, from a compliance point of view, sometimes other people need to watch people take their medication. So if you can see there's a blister pack with a capsule gone and it's nowhere lurking around, can be reasonably sure it's down someone's gob. Whereas the oil, it's not so easy. And there was a patient of ours that he just couldn't take it. It was too bitter for him, and his wife literally had to take the oil out and put it in the capsule, and then he actually got really good benefits. So yeah, there's a number of pluses and a number of cons to most dosage forms.
I've actually got one question just on the vaping. As a pharmacist, you're the perfect person to ask, in fact. But in terms of the actual instrument used, the medical device for vaping, am I right in understanding that those products are themselves a scheduled device that you would need, in every case? Or because, you do see certain devices that technically you could put cannabis oil in if you understand what I'm saying. There's vape, say, nicotine products out there that you could refill with oil, so to speak. And there's a lot of confusion, people asking that question a lot. Well, why can't I just use X vape for my oil, or repurpose it myself? What's your viewpoint on that?
Well, a lot of the oils that they have for oral formulation aren't designed to be vaped, particularly olive oil. It doesn't necessarily combust. So they really do need to use a flower product in the vape. And there is, I believe, one product that's approved on the Australian Therapeutic Goods Register as a medical device. I think there was one at last count, but there are some devices there that patients can access quite readily.
Okay, fantastic. And I think another area that I definitely wanted to touch on was, and we were talking about this just before we jumped on, but that kind of potential for cannabis to take over in a similar way from the opioid kind of production from Tasmania, for example. You know, we're really one of the primary producers of that. You know, if you don't really include Afghanistan and the rest of that, in terms of the medical market for opioids, and looking at cannabis to take over.
Don't think there's anything GMP happening in Afghanistan, just by the by. But anyway,
yeah, that Afghani GMP.
They do grow it, but it might be diverted to the wrong sources. But yeah, it came as a real surprise to me that Tasmania grows or has grown between 50 and 70% of the opium poppies that are used to make these nasty opioids, which I'm always bagging in the marketplace that cannabis is starting to take their market share. But also there's price dropping from the cultivators of opium poppies are being paid. And there's other jurisdictions around the world that are starting to grow them. So a lot of these farmers are looking at replacing their crops with cannabis-based crops as that market takes off and it becomes more valuable. But one really interesting thing is they've grown opium poppies for years outdoors, and it's processed with American money. And there's a thinking that maybe you don't need to grow cannabis indoors. You can potentially grow it outdoors, given the right circumstances. And that part of it's really interesting. Not my area, but I think Australia has got a really good record of having pure agricultural things that are exported and test pretty well, particularly given our close proximity to some of the nearby massive Asian markets who've used cannabis traditionally for thousands of years. And we are looking at exporting in those particular markets, which is quite exciting.
Yeah, well, that's actually why it was called weed, because it grew like weeds in the right circumstances. It just grows crazily. So it definitely can see that. And Australia has a kind of landscape. I'm not sure about how, I actually don't know how well Tasmania maybe it is at producing poppy seeds down there, or poppy rather. But definitely up north, you could see some of those crops getting some great sunshine. And
if only we made amendments to our, like, the microbial limits on plants, because I know that, in those sort of more tropical regions, there's more of a potential for fungal and mold and these sorts of things. And we have such strict parameters in this country around what's allowable, such that many companies, resorting to radiating their crops and these sorts of measures. Hence, we've had flour shortages. I'm sure you've seen all of this play out, Paul.
Well, I think a lot of people are still gearing up their production facilities. We're still pretty new to this. People, in some cases, haven't grown cannabis at scale, are learning from their mistakes. And as much as anything else, it might be expensive mistakes, but it's still a pretty new industry. But there's certainly hope and potential. A lot of these places have more people working in their quality control section than they have in their cultivation section. So to get a product to market, takes a lot of work. It's easy to grow cannabis at small scale, I'm told, but to grow like a massive scale that's economical is a very skillful process that it needs someone who knows what they're doing.
Yeah, absolutely. And it's interesting. I think about, when we're comparing it just before to poppy and opioids, for example, we do hear quite a few people saying, we're not even producing enough for the local market. Why would we be exporting to places like Germany? But then on the other side, you think, well, have a look at the price of an opioid medicine versus the price of a cannabis medicine currently in Australia. And in my head, the more we produce, the quicker we get to scale, the quicker we bring down those prices. So when you think about that at scale, that's immediately where my mind goes to. Is there any commentary on that you might say?
I think a lot of people are racing towards that flower market, and that's going to become very crowded very quickly, because it is a small market, as David said. It's leaning towards something which is more pharmaceutically elegant, I like to call it. So that's been processed into an oil or a capsule. There's some great dosage forms coming through, hopefully some topicals soon.
Yeah, I can see you're just raring at the bit for a couple of topicals.
Yeah, we need some dermatologists to really embrace. I'm sure there already would be, perhaps a few around the country, but I haven't seen the proliferation yet of topicals containing.
Well, for even topical pain, I found out quite recently that topical Voltaren or diclofenac only works about 10% of cases, which is pretty crap, really. If you bought a product and 9 times out of 10 it ain't going to work, I'd be pretty disappointed. But I have heard some preliminary medicinal cannabis products have got far better results than that, up around about 50% mark, that it works, which is sensational for people that are suffering.
It's amazing then that medicine actually gets entered on the Australian Register of Therapeutic Goods when there's such a poor efficacy case. But anyway, that's just Andrew's little side commentary there. I want to talk to you guys about some synergies between Health House and Canpharma. I guess hearing from you before, David, talking about how you're based in Barcelona, but you're in a country where it's not yet legal, and through Calapa, you're basically undertaking the very noble duty of educating the public and getting everyone on board for when that moment comes. But yeah, what are some of the I guess the plans going forward that you guys have that, of course, we can speak to? I don't want to raise anything that's under wraps.
I think, well, I mean, I've gone on and on about Germany being the only market of scale, and so I think certainly we bring a piece of the puzzle that Health House didn't have before. Spain will open up at some point. I'm not taking bets on exactly when, but
it's going to be my next.
You know how these markets go. But Spain is 45 million people, and it's the only big country within Europe that doesn't have a program. So the direction of travel is clear. Spain will open up at some point, and we think we're well positioned due to our reputation and understanding within that market. So that's, I think, what we bring. And some of the stuff we can do jointly, I've said, is medical education. We are Calapa does provide consultancy to patients. It's just that we're not on the market they can actually prescribe, but we will be leveraging that experience into Germany and then sort of providing that holistic understanding of the patient, working with, and I think sort of the back and forth across markets, because I'll say it again, these markets are already forming. So the understanding between us and Paul and how the UK will open up, because obviously Health House is positioned in the UK, the UK tiny market at the moment, but longer term, again, the direction of travel is clear. So having that spread and that experience across different markets, I think is a great synergy. Paul has amazing contacts with manufacturers, and we hope to be able to leverage that into Germany as well. And we are, I mean, we are a cannabis distributor, but we're one of the few cannabis players in Germany with full GMP manufacturing license, which enables us to put our own brand product in the market, but release other people's products into the market as well. So that provides us with a springboard, provides us, Health House, and third-party brands with a springboard into the German market. So I think, Paul's got great experience there, and so we're looking forward to seeing these move together and being poised for a European platform, because, as I say, Spain will open up. Calapa Clinic works across Europe, and we're waiting for the different markets to scale, but we will be there to take opportunities as and when they arise. So I think that's what I'm looking forward. Paul, what about you?
Well, I think Germany is a beachhead into Europe for Australian medicinal cannabis. So I'm a bit one-sided here and patriotic in that respect, but having the partnership with Canpharma is really exciting because they understand the German market, and there's 14 different states and 14 different jurisdictions and laws, and it can be quite confusing. So it's handy to have David and his team as part of our group moving forward. And a lot of our suppliers were actually super excited because some of them have been trying to navigate themselves, but they've got this great product that would be really good to export and get the sales into Europe, because it's a quality product that is of a global standard that we're hoping to export at scale from this end.
Excellent. And is there it'd be remiss of me not to ask this, but my twin brother is actually based in France. You got 67 million people there. What's any insights on what's going on over there, and perhaps any changes that they need to make to sort of get the cred that Germany does?
France, I mean, I know it got knocked off a bit by COVID, but I don't know exactly when it started, but France has started its 3-year pilot program. So, I mean, the French government took advice, went through lots of hearings, and decided to take an evidence-based approach to their further legalization. So by that I mean a certain number of manufacturers and producers of cannabis were required to give their product away for free, and then they'll give it to a certain number of patients and collect evidence on that over a 3-year period. I think it started last year or early this year. So it's going to take time for that to open. But look, all of us who are in the cannabis industry definitely believe in the potential of the plant. And so one can only assume that the results of that pilot project will be positive for the industry as a whole, and that France will scale after that point. How and when and who's going to be there is all up for grabs. So 3 years is a long time in the cannabis sector.
Oh yeah.
And so I'm sure the French industry will evolve in ways that we didn't expect it, but certainly being on the ground in Europe, being sort of in touch with patients in France and being next to France through Germany and Spain, it's definitely a prize we'll be looking for as the opportunities come up. But you're right. I mean, do you say 67 million people?
Yeah.
There's a huge unserved patient population, and we hope that they can get product as quickly as possible.
A bit of a domino effect happening globally. There's so many jurisdictions that it fits quite nicely into the system when sold through pharmacies. It takes regulators a while to get their head around it, but once that clicks, that it's the same as any other pharmaceutical molecule. It's exciting times, and it's not currently legal yet in Spain, but it's only a matter of time.
Yeah, and I've got just a question I was thinking about just then. We're obviously all Australian. We have Australian listeners. We think about things in Australian terms a lot of the time, in terms of when we're importing products, which most of the market is still currently over here. We think about, a lot of it's Canadian. There is some European products. There are some things starting to come in from Africa, the Caribbean, places like this, some South America as well. How do Germans receive Australian products when compared to, say, Canadian products or elsewhere that might arrive on their shores, especially considering that you do have this other movement of products that can come from, say, America or in that kind of novel food range in Europe that is not the same as medical, obviously, but is very much a competing industry. I'm just curious. There's kind of two questions wrapped up in there, but any thoughts on that would be very interested to hear.
I think to address, I think part of the second question first. I mean, we do regulated products into the regulated channels. So it's pharmacy prescribed by a doctor, supplied by a pharmacist, and so the US as yet is unable, because of the federal ban, is not able to supply some of the OTC products. I mean, yes, they could be said to be competing in the same way that sort of aspirin can compete with some other pain relieving products, but I think the core of the medical cannabis market is the competition is within the regulated channels. I don't know. I don't know how to answer the question about how German patients perceive Australian products, but I don't see why they would see it as any worse than it, if not better. I mean, the Australian system is closer to the German system in terms of what Paul does, what doctors do. Obviously, the Canadian system is a bit more akin to, I mean, they patients register, it's through a separate system to recreational, but I think perceptually it's a less of a patient focus than the Australians. So, I mean, I mentioned, like, I can't remember when I was talking about like how we were going to work together. What we're certainly excited for is be able to bring some of the products that Paul uses in Australia, knows, and we have the group, when we're finally a group, the group will have experience with, to bring those into German and offer a wider range of products that have been branded products that have been adopted by patients in a more similar market. So, as I say, we haven't done any research in terms of country of origin perception, but I don't know why there would be any different view on it or negative view on it. I mean, as long as, I mean, it's incredibly. I mean, we've been blooded in the battle of regulatory. Of regulatory registration, and the German pharmaceutical regulator, and this goes back to someone's point earlier about the need for quality standards. I mean, it has to be of the highest standard. Patient confidence and perception is incredibly important, and any product coming from anywhere in the world has to jump through a lot of hoops in terms of where it's grown and the chain of custody through GMP and equivalents. And the Canadians have found problems of focus in getting some of their facilities up to EMG or registered as EU GMP standard. But one of the advantages the Australians have is the mutual recognition of the TGA standard there. So that I think is a vote of confidence in the Australian industry.
And I know ANTG product was received really well in Germany, and we suspect it'll be a big success because our staff joke that when it comes into our warehouse that dogs follow the courier down the road because it smells absolutely amazing. I'm used to oils and capsules that don't smell at all, but it's got an amazing aroma that I'm sure translates into a really efficacious product.
Yeah. You can make really good incense out of it, actually.
So one of the things about flour is for the Australian market, the Australian government allow the flour to be plus or minus 20% of the stated content, but the German market is stricter, it's plus or minus 10%. And a lot of the, I'm told, Canadian imports have been failing, where the Australian product is always bang on the money because our standards here are so high, which is a good thing.
Yeah, it's impressive in the sense that there's always been that discussion in our emerging market around stabilized genetics, because a lot of these cultivation facilities are fairly new. But yeah, that's very good to hear. Well, look, mindful, that we've taken up a bit of your time, guys, but really just unless any final thoughts, just wanted to say thank you so much. I know organizing these things around the world and getting everyone on at the same time always comes with its logistical challenges, but you've both been very accommodating, and we're very grateful to have your insights and you sharing your experiences. So thank you.
Absolute pleasure. Thank you.
Thanks for having me.
Yeah, it's been a pleasure. Thank you.
Yeah, and we'll be, we know that story about you being the maverick importer in Australia, and it looks like more pioneering to be done over in Germany and beyond. So we'll be watching on with interest, and at some stage it'd be nice to check in and hear how it's all going.
I'm not sure how my bad dad jokes are going to go down over there, or even
they're very serious.
Another market I'm really passionate about is the Asian markets, which I think is a subject for another.
We'll do Asia next time. Yeah, Thailand.
I'm happy to.
Thailand.
Japan just announced legalization.
Yeah.
Yeah, exactly. So we'll have to do the podcast from there, unfortunately. So,
if we can't get topicals, If we can't get topicals off the ground here, then I'm sure we can just, look to
definitely happening.
No, very good.
Hay smoked, you know how they do that hay smoke thing, but with cannabis, you can actually do it like a yakitori kind of thing, I think.
All right,
brilliant.
guys.
Well, thank you very much for being a part of the program. And yes, we absolutely look forward to having you back again, maybe in a few months or down the road when we open the Asian market.
Indeed. Thanks so much, guys. Appreciate your time.
Thank you.
Thank you.
Take care.
Good night.
Bye.